I'd like to welcome all attendees of the International Mental Health Conference. But I'm very much concerned about the first sentence of the theme of the conference, which is awareness. Awareness of mental illness will lead to early detection, early treatment, better quality of life of the patients. And so probably I'll be speaking mainly about one of the main things to reduce the stigma of mental illness, to fight the stigma because of mental illness. You are all aware that in our part of the world and in many other parts, there are so many people who still believe that mental illness is caused by evil spirits or witchcraft. Actually, it's a brain disease. It's not caused by a curse or evil eye or God's punishment for family sins. It's not a form of demonic possession. It's not the result of frustrated love. It's not so many things. And this makes the people go for some sort of traditional treatment, which usually will not help. The main fight for the stigma and the discrimination against mental patients is to tell them that it is a brain disease. It is not caused by extraordinary things. And even in the Quran, they say, or in the Islam, we say, إِنَّ لِكُلَّ دَاءٍ دَوَاءٍ. This means that it encourages people to go for help and treatment from the specialists. So actually, we'd like to emphasize the fact that we would like to improve the quality of life of individuals with mental illness, and this should have more than the treatment strategies, to have the reduction, or if we can, remove the stigma of mental illness. There are so many roles how to exercise this sort of alleviating the stigma through the mass media, through education, through rehabilitation, through the facts that the mental patient can work, can marry, can produce, it's not infectious, he is not violent as people and the mass media portrays mental illness in some films, old films, new films usually is better than this. So I'm very happy and pleased and inviting people to attend a very important subject. The psychiatrist should not only treat by drugs or by brain synchronization treatment or by psychotherapy, but you should orient the people. My lecture is how to educate the people to understand mental illness, that it's a brain disease.